All right, hello everyone, and thank you for joining the webinar. Today's presentation, Secure Our Herds, Preventing Bird Flu on Dairy Farms, is part of the USDA's Secure Our Herds campaign, promoting awareness about the importance of biosecurity and ways to prevent the spread of bird flu in dairy herds. I'm Eric Gabriel, Public Affairs Specialist with USDA's Animal and Plant Health Inspection Service. Welcome to the show. On today's webinar, we'll discuss the status of bird flu in dairy cattle, control and surveillance of the virus, available support programs for producers, and the importance of biosecurity, along with the free resources that are available. Before we start, just a few housekeeping items to share. Closed captions are available for this program. To view, click on the CC bar, the CC in the bar at the bottom of your screen, and you can click on the captions at any time during the program. To submit questions, click the Q&A button also located down at the bottom of the screen. We will gather and answer all questions after the webinar has concluded. The Q&A will be posted along with a recording of this webinar on the Secure Our Herds website. Also, be sure to follow APHIS on Facebook, LinkedIn, and X to find out when the Q&A and recording will be available. We'll share those online destinations later in the webinar. Now, I'll take a few minutes to introduce today's presenters. First, we will hear from Dr. Bradley Christensen. Dr. Christensen is a veterinary epidemiologist with USDA APHIS Veterinary Services Cattle Health Center, based in Manhattan, Kansas. He has led poultry and dairy HPAI investigations across multiple states since 2022. Next, we have Dr. Jennifer Sambita. Dr. Sambita is the Assistant Director with APHIS Veterinary Services Ruminant Health Center and a member of the Cattle Health Team. She's also the National Incident Coordinator for HPAI in dairy herds and has over 20 years of experience in foreign animal disease response and preparedness, both globally and domestically. Dr. Stephanie Ringler is a veterinary medical officer with APHIS Veterinary Services Ruminant Health Center and a member of the sheep and goat team. She's also currently detailing as the USDA HPAI Poultry National Incident Coordinator and has been with USDA APHIS Veterinary Services since 2015. Dr. Stacy Schwabenlander also joins us. Dr. Schwabenlander is a veterinary medical officer with APHIS Veterinary Services Ruminant Health Center and a member of the Cattle Health Team. She joined Veterinary Services Ruminant Health Center in December 2021 and is the manager of the HPAI Dairy Herd Status Program. And finally, in today's lineup is Dr. Tyler McAlpin. Dr. McAlpin has worked for the Ruminant Health Center since 2013, supporting emergency preparedness activities such as the Veterinary Services Training and Exercise Program and the National Animal Disease Preparedness and Response Program. Thank you all for joining us today. We will start off with Dr. Christensen, who will talk about the current status of bird flu in dairy cattle. Dr. Christensen, off to you, sir.
All right. Thank you, everybody, for joining today. I'm going to spend about the next 15 minutes talking over a lot of information with you guys today. I'll try to summarize some high points for you. So what is bird flu in cattle? You've probably heard this referred to by a lot of different titles, dairy high path, dairy HPAI. You may have seen references to it by its more scientific technical name, like the first bullet point there, highly pathogenic avian influenza H5N1 clade 2.3.4.4b, or some variation of. This is just a reference to the specific strain of the virus that we've been seeing in dairy cattle the last couple of years. It's not necessarily important that you understand how and why those are named. This virus can cause pretty severe systemic illness in primarily lactating dairy cattle. We'll talk about more. It can spread rapidly within herds and between herds. This is not unusual. It's just how it behaves in other species as well. We find virus primarily in the milk, but we can find it in other secretions as well. There's a lot of conversation around milk when you talk about this disease in dairy herds, and that's primarily because it's the main sample we use to most reliably find the virus in infected animals. But I do want to make a point here and reiterate that it's been well proven that pasteurization is very effective at killing this virus. I just want to reiterate that up front. The last point, another thing I want to emphasize, that this virus we find in dairy, it's the same virus that can affect poultry. We can actually infect people and other species. This is not a dairy cattle specific virus. I just want to make that point up front. Next slide. I talk a little bit about the clinical signs. I don't want to go over all these individually. We'll just hit some high points. This graph you see to the right is all based on data collected from questionnaires we did with dairy herds, more than 400 dairy herds across this outbreak. If we start at the top, kind of the hallmark sign that is reported with this disease in dairy cattle is a really dramatic and sudden decrease in milk production. It's, within hours, people will report going from near peak lactation to almost nothing. Um, it's also accompanied by abnormal milk, usually kind of a clear, watery to yellow um, type of milk, sometimes described like colostrum type consistency. We also see pretty consistently a drop in feed consumption and rumen motility, unsurprisingly. Down towards the bottom, fever and dehydration also very, very consistently reported, and high fevers, 105 plus temperatures frequently. I do want to note you can see abortions there listed in that lower column, about 35%. Now this isn't really consistent across every state. We had one state in particular that had a lot more abortions reported than other states, so that number percentage might be a little skewed, but it is a reported finding from this disease in dairy cattle. What you don't see on this slide is a mortality rate. I don't have a number here to give you, but we generally consider this a fairly low mortality disease in dairy cattle, but what's also not reflected is the cull rate. A lot of these sick cows, they don't really return to full health. They dry off early. They either don't return to any milk production or they just can't regain full milk production. So they get culled earlier than they would have in a normal situation. So even though we're not necessarily seeing a lot of cows dying from this disease, we do see a very significant impact on some of these herds with the culling rate. Next slide, please. Let's just talk a little bit about the outbreak in general. Our first official laboratory confirmed detection was in March 2024 in a Texas dairy herd. This had followed a couple months of reports from practitioners and dairy herds in Texas area of this kind of undetected or undiagnosed disease that seemed to be circulating in those herds. Since then, we've had well over 1,000 confirmed detections in 19 states, with California being really the most heavily impacted and accounting for probably three-quarters or more of those detections. I will note here too that that number, 1,000, probably underrepresents the true number of dairies that were infected over the course of this outbreak. In the many conversations we had with infected herd owners and vets, many of them told us they're aware of other herds that went undetected or unreported during early parts of this outbreak too. So that number is maybe even a lot lower than it actually was. Herd detections peaked in late 2024. I'll discuss that more on the next slide. Um, we believe this outbreak all started from a spillover event from wild waterfowl, a novel introduction of virus from wild waterfowl into dairy cattle. And once it established itself in dairy cattle, we saw it spread very swiftly from herd to herd and through herds, more of an animal to animal transmission mode. Um, this is different than what we see with poultry, where we get this continual reintroduction of virus into poultry flocks from wild waterfowl. Most of what we see with dairy is a herd to herd transmission. Though we have found three more events where we think there was some spillover from wildlife into dairy cattle. Those other spillover events didn't really seem to result in quite as extensive spread as the original event. Next slide, please. This is our epidemiologic curve over the course of our outbreak since March 2024 till now. The blue bars represent the monthly confirmed detections across time. Over on the far left, you can see our first kind of initial peak we saw was around June 2024. By this time, we'd already seen detections in multiple states starting to pop up. This is the portion of this curve where we think there were probably a lot more herds that were infected than were shown on this chart because they went unreported or undetected. By the summer, our diagnostics started to improve. We had better ways of finding this virus and detecting it, and states started to develop a lot stronger surveillance programs. And you start to see from that September to January timeframe a huge jump in detections. Now, this is primarily a result of uh, the virus finding its way into the California dairy shed. This wasn't the only state affected during that time frame, but they far and away had the most detections. Fortunately, by this time last year, things were starting to calm down a little. We had another little peak late spring as we found some detections in other states. But really, since the summer, our new detections have remained pretty low, though we're still continuing to find some periodically. Next slide, please. So these two maps, you can find them at the QR code on this slide as well. It's on our public-facing website, just to kind of give you an idea of how far and widespread this virus has been in our dairy industry across the country over time. On the left, that's over the cumulative almost 2-year time span. All the states colored in blue of where we've had confirmed detections. The darker the color of the blue, the more the detections in those states. As you can obviously see, this is spread to a pretty wide swath of our country, including most of our biggest dairy producing states. On the right, it's blank, it's clear. That's our 30-day map. Fortunately, it's been quiet recently, like we saw in that last chart. Doesn't mean it's gone, but it's been quiet recently. Next slide, please. I'm going to spend a couple minutes on this slide. This infographic, there's a lot of information here, and I'll try to boil it down to a few key takeaways here. But the purpose of this infographic is really to set the stage for some of the biosecurity discussions you're going to hear later in this presentation today. This infographic was based on data and information pulled from EPI investigations that were done during this outbreak to try to learn more about the virus, how it behaves in herds, but more especially how is it spreading and moving. Let me just start with the top row with animal movement. We know pretty confidently that this virus can move from herd to herd with infected lactating cattle. That's very clear. That's how multiple states got this virus was with lactating cattle. But we also found about 40% of the herds that we interviewed didn't have any live animal movements in that month before they got infected. So we know it can move with lactating dairy cattle, but we also know there are other mechanisms in play too. We just haven't necessarily pinned down all those mechanisms yet. The second and third rows on this infographic are supposed to kind of represent the different risk factors and potential modes of transmission that we wanted to look at. I think a lot of people on this webinar are relatively familiar with the activity on dairies. There's, constant movement of dairy or milk trucks and feed trucks and rendering trucks, equipment, workers, vehicles, visitors, cattle are often or frequently at least have outdoor exposure. So there's a lot of potential mechanisms or places where viruses can be spread on a dairy. And this is not an indictment of the dairy industry in any way. We're just saying there's a lot of places where this virus potentially could spread from one place to another. What we found when we evaluated a lot of these questionnaires and studies is one, yes, there's a lot of potential risk factors out there, especially when you compare to confinement livestock industries like swine and poultry, where you have a little bit more control over exposure. But the other thing we found was after analyzing a lot of this data, there really isn't one or two or three of these specific risk factors that stand out as a culprit for how this virus is moving in a dairy, off a dairy, and onto dairies. So it's really forms the basis for why we make these biosecurity recommendations that you're going to hear more about later in this presentation. The low bottom line on this chart is about wildlife. That question always comes up in conversation about how are they involved in this whole process. USDA Wildlife Services has done a ton of testing on infected dairies and poultry operations over the last couple of years, looking at wildlife, birds, peridomestic species. You'll see a cat icon on there. We've had a lot of reported cat deaths on these dairies. They seem to be very susceptible to this virus for some reason. But the two key findings from all this testing is one, yes, we do find this virus in a lot of different species of wildlife and birds in and around these dairies and poultry operations that are infected. We can find that virus. But the other finding after looking at some of the genetic analysis on this is that it doesn't really appear that they're actually spreading it to other dairy or poultry operations. They're almost like a incidental spillover host that's getting infected with this, but not really implicating them necessarily as a cause of the spread from operation to operation. Next slide, please. Okay, I'm just going to leave you here on this last slide with a few key things I want you to walk away from with my portion. Again, this is the same virus that can infect poultry. It can actually infect people and other species. Again, this is not a dairy-specific virus, even though we have that commonly in the name of dairy high path, dairy HPAI. This is not dairy-specific. Wild birds are not the problem of why this is spreading from herd to herd, state to state, flock to flock. That's where the original virus came from, was wild birds, but the spread that we see is really a dairy to dairy, animal to animal, maybe fomite type transmission. Lactating cattle are more likely to show clinical signs, but we know that non-lactating cattle can get infected too. We find antibodies in calves and dry cows and young stock, so we know they can get infected even though they may not necessarily show clinical signs. So just relying on finding clinical signs or clinical symptoms in your lactating cattle probably isn't a very reliable indicator of whether there really is virus or not in your herd. We've learned a lot about this virus in the short 2 years this outbreak has been going on. A tremendous amount of research has been done and is still ongoing because there's a lot of questions we still need to answer about this virus and how it behaves and how it's transmitted. We've got lots of great state and industry partners, private veterinarians, herd owners, academia doing that work right now. And lastly, this outbreak, it's definitely slowed down to compared to where this was last year, but it's not over. And the fact that we've seen it spill over several times from wildlife we may never completely be out of risk from this disease in the dairy industry. Next slide. All right, I would like to hand off now to Dr. Simbeda to start her portion of the presentation. Thank you.
Thank you, Dr. Christensen. For my portion of the talk, I'll talk about the response measures that APHIS implemented, and then I'll talk about the national milk testing strategy. So the first measure that APHIS took was to reimburse for HPA testing for livestock at all the national animal health laboratories throughout the U.S. And this included samples that would be submitted for dairy cattle that were suspected of having disease because they had clinical signs, interstate movement testing, producers interested in the disease status of their animals that aren't showing clinical signs, and then any of the disease testing that occurs during a disease investigation for an affected dairy. On April 29th, the first federal order was issued, and this gave us the authority to monitor and understand the extent of the virus and reduce the risk of further spread of the virus. And this required reporting or testing of lactating dairy cattle that are moving interstate. So before they move, they had to be tested for HPAI. And if they were positive, then the owners were required to provide epidemiological information, including animal movements into and off of the premises. It also included mandatory reporting by laboratories and state veterinarians of any positive samples in livestock. The next federal order was in December, and this required mandatory testing of HPAI in raw milk that was destined for pasteurization. It also included a mandatory reporting by labs and state veterinarians of any positive milk samples that were detected. Again, owners were owners of herds that have positive milk samples must provide epidemiological information, including animal movement in and off of the farm. Next slide. This slide is our overall response strategy that I wanted to go over. It really involved 4 pillars. The first being to understand the virus in cattle, the pathogenesis and transmission. And pathogenesis is just how the disease develops in cattle. So to understand that better, we did over 500 on-farm epi questionnaires, and Dr. Christian talked about those. That's how we identified those risk factors that he spoke about. We also look at the sequencing of the virus, the genes of the virus, called phylogenetic analysis, and from that we're able to better get an idea of where the virus came from, whether it came as a spillover from wildlife, or whether or not it came in state or even came from out of state. In addition to that, there were on-farm pathogenesis studies and lab pathogenesis studies. The second pillar would be to understand the distribution of the virus. And first off, we activated all of the national animal health laboratories in the US, throughout the US, and they implemented testing for livestock for HPAI. We also funded all of this testing. And then the 2 federal orders that were implemented also helped us understand the distribution of the virus, where the virus was. Interstate testing of the lactating dairy cattle allowed us to identify any infection before the cattle moved, so then that prevented it from spreading. And then the other federal order in December allowed us to establish our national surveillance for HPAI and dairy cattle. And then we also have the voluntary dairy herd status program, and Dr. Schwabenlander will talk about that later. The third pillar is to stop the movement of the virus. We did that by doing outreach and education on the disease and how to prevent the disease getting onto the farm. Also, when there was an affected farm, states would implement their own restrictions, such as quarantines and movement control restrictions for lactating dairy cattle. The 2 federal orders that I mentioned also helped slow the movement of the virus, and then the dairy herd status program. The fourth pillar is providing support to producers, and we did that by providing diagnostic testing that was free of charge. Also, financial support for the producers, which Dr. Ringler will talk about that later in the presentation. We also had the Farm Service Agency Indemnity for Milk Loss program, and then the dairy herd status program. Next slide, please. The goal of our national surveillance is to identify and eliminate HPAI from the U.S. dairy herd. Before the federal order was issued in December of 2024, our surveillance consisted of 3 surveillance streams. 1, sick animal testing, or on the slide it says suspect case investigation. 2, interstate movement testing of lactating dairy cattle. 3, the voluntary dairy herd status program. With the federal order, when it was issued in December 2024, it added another stream to our surveillance. This was called the National Milk Testing Strategy, and that incorporated nationwide testing of our raw milk that's intended for pasteurization. Next slide, please. Our National Milk Testing Strategy is our national surveillance, and it's our roadmap for eliminating HPAI from our U.S. dairy herds. Through this strategy, we're able to identify cases quickly and respond rapidly, implementing enhanced biosecurity and control measures like quarantine and movement restrictions. It was developed in consultation with animal health and state partners across the country, and it was implemented in a phased approach across the lower 48 states. States can conduct silo surveillance and on-farm surveillance, or they could do both of them. And once and they do that to be able to identify if the virus is in their state, and then once so much surveillance has occurred, then they'll be able to advance to unaffected status because they're shown that their state is absent of the virus, does not have the virus. Affected states respond quickly to contain the virus. Once all states get to unaffected state status, then we will continue monitoring on a national level of the silos throughout the U.S. Next slide, please. This is a screenshot of the national milk testing strategy. The QR code at the bottom will link you to the map. It's an interactive map. To date, 46 states are enrolled in the national milk testing strategy. 30 states have the unaffected state status, and that's the gold color on the map. These states have conducted enough surveillance to demonstrate the absence of the virus in their dairy cattle in their state. Once in this status, states continue conducting surveillance, either surveillance at the silo level or on farm at the bulk tank milk level. There are 6 affected states, which are indicated by the blue color on the map. What affected state means is that they've had a detection in their state and they've identified it, they're responding to it, and they're containing the disease within their state. States will remain in affected status until sampling demonstrates absence of the virus on the detected farms, and then there's no new detections in their statewide surveillance that's ongoing. The long-term goal is disease freedom in the U.S. dairy herd. Once all states have reached unaffected status, national surveillance will continue. The system does work. We have successfully identified 4 states that previously that we did not know that they had the virus. And we're also able to identify 6 states that previously had detections. And we did that through this national milk testing strategy. Next slide, please. I wanted to briefly go over how silo surveillance works. There are 24 states enrolled in silo surveillance, and these 24 states collect milk samples from silos where the milk is stored at the processing plants. This map shows the states in blue where the milk samples originate. The map demonstrates the milk sampled from silos in 24 states represents milk from 44 states. Again, sampling in silos in 24 states gives us a good idea of the HPI status in 44 states. The long-term goal is to have states conduct silo sampling. It's just the most effective way to detect new cases. It requires sampling all silos with milk destined for pasteurization 4 times over 6 months. And silo sampling requires the least personnel and least financial resources. And it's what we'd like all states to be doing once everybody's in the gold status or unaffected status. Next slide, please. This map shows the total number of tests conducted by state since April 29, 2024. The lighter color is 1 to 1,000 tests, and then the darkest color is 10,000 or more tests. This includes all the testing done as part of our national surveillance, which includes testing conducted on sick animals, testing conducted on lactating dairy cattle moving interstate, testing conducted on herds enrolled in the Voluntary Dairy Herd Status Program, and then testing done on milk collected from silos or from bulk tank milk on farms. Over 423,000 tests have been conducted nationwide. Because of the robust testing, we have a pretty good idea of the distribution of the virus nationwide. And that's all I have for my presentation. I'm happy to hand over to Dr. Ringler, who will talk about producer support programs. Thank you.
Hi, everyone. I'm Stephanie, and I'm going to talk about producer support programs. Next slide. How we're helping. We are giving financial supports for personal protective equipment support, biosecurity planning and implementation, heat treatment of the milk, and veterinary costs and labor associated, and sample shipping costs. We do have other supports as well. Next slide. So for affected dairies, we are giving $28,000 to help. Information can be found at the website listed above. USDA support includes, again, PPE, assistance with creating biosecurity plans and implementation. Implementation could include putting out foot baths, signage, buying special chemicals, items like that that can help prevent the virus. Funding for heat treatment to dispose of milk, reimbursement for veterinary costs and farm labor to administer treatment. So if you have 3 employees that treated all of your sick cows for X amount of time, we can help cover those costs. Also, the offset of shipping costs for the testing of HPI. If you're interested in this, producers can contact their area veterinarian in charge to enroll. Next slide. Next slide, please. All right, so sorry about that and the technical issues. Next slide, please. So again, for unaffected dairies, you can get $4,000 for support. And again, this is going to be for biosecurity planning, reimbursement for sample collection, and offsetting shipping costs. Again, I know that these are very kind of gray area items, and my team is happy to discuss more with you and talk through what we've been supporting in the past. So far, we have given money to over 500 dairy farms in the last year. So we'd love to work with you and find a way to get you this money if this is something that would help out your farm. Next slide. So again, we've made this little chart, and maybe this is something that you want to look at later on. You can see that we have affected prems and unaffected prems. So, I would assume that a lot of us on this call are probably under the unaffected prems. And so you can see that you can get up to $1,500 for biosecurity planning, and then you can get up to $2,000 for veterinary costs. There is no support available for pasteurization or PPE support. However, I know a lot of states can provide PPE to your farms if you're in need. For affected farms, we can help with PPE support. This would be buying boots and Tyvek suits, goggles, gloves, etc. Biosecurity planning, again, this is going to be training for your employees, or maybe you've been able to implement it over the past 3 months, and we can help kind of pay for those labor costs. Heat treatment, we can help pay up to $8,000. Veterinary costs up to $10,000. This would include your farm labor, actually giving treatment to the cows, or the time that they used to help the cows when they were sick. That could be like moving them from different pens or having to figure out logistics. This could also be for medications or working with your veterinarian. And then we have sample shipping costs. Again, we'd love to talk more about it with you one-on-one because I know every farm is unique. Next slide. So to enroll, again, talk to your area veterinarian in charge via email or phone. They would have you sign an agreement that basically states which items that you want to opt into. Maybe you don't want to do the biosecurity planning and the heat treatment and you just want to do veterinary costs, that's fine. Then we would have you register for a SAM, and then you would submit your receipts and other documentation. Right now, the process could take as long as a month to 3 months. It just depends on, how quickly you get in your receipts and we get it processed. Next slide. All right, and now you're going to hear from my colleague, Dr. Stacy.
Good afternoon, everybody. We're going to take an opportunity here to chat a little bit about the Dairy Herd Status Program, which you've heard mentioned a few different times during this presentation so far. So the first question you probably have is, what benefit would this program provide? So why should you even consider participation in this program? So there's a handful of reasons that this can offer you some benefits. To start off with, as you are aware, there is currently a requirement for lactating cattle moving interstate to have testing under the federal order, which was put out. So that was mentioned previously. And participation in this program, once you reach a unaffected status, would allow you to be exempt to that federal movement testing. So it would allow you to be able to move your cattle more fluidly without any additional testing on top of what you're doing as part of the program. I should also mention or reiterate that this is an exemption to that federal testing. So if there is testing that is required by individual state for moving lactating cattle, the program would not specifically exempt that unless the state has an allowance for that. But this would be an exemption to that federal testing. And the sampling kits and shipping labels, which would be needed to move those samples that are collected on the farm to our National Veterinary Services laboratories, are all at no cost to you for all of the milk that's collected each week. So that's another nice benefit. You don't have to cover the costs of participation in the program. In addition, if you are commonly marketing your cattle or moving them, you can utilize your monitored unaffected status as a marketing tool to make it clear that you have already maintained that status. And that way, if there are other farms that are interested in ensuring that they're only purchasing cattle from known unaffected herds, you would be easily able to identify yourself as one of those herds. So it would increase your chances of more fluidly being able to move those cattle. And Dr. Ringler already told us about some of the other financial support options. So, of course, you would be eligible for that as well. And finally, Dr. Simbeta talked a little bit about the National Milk Surveillance Testing Program. And in that testing program, when there's a non-negative silo sample, those samples are traced back to find the origin of that non-negative milk. So if you're a participant in the program and you're regularly doing this collection, then you have a known status. So if you get one of these tracebacks to your farm, you will not have to do any additional testing, and there won't be any additional investigative work that needs to happen with your farm because you would already be participating in a program and you'd already be under a known status. So it can save you some time and resources there as well in the event that there would be that non-negative sample that would trace back. And you can go ahead and move to the next slide. So this talks about that monitored unaffected status. And I apologize, that should say unaffected, not affected status. So there are two different major routes that you can take in order to acquire that unaffected status. And it's going to depend on whether or not you're a farm that has had any previous detections. So in the event that you've never had this virus detected on your farm, it's fairly straightforward process. So you would take 3 consecutive weeks of samples, and this would be bulk milk samples. And then as long as you have not detected results from those bulk samples for those 3 consecutive weeks, along with no clinical signs in your cattle that would indicate any high path infection, those clinical signs, for example, that Dr. Christensen talked about earlier, then you would be eligible to get monitored unaffected status in your farm. You do not have to collect from sick or fresh animals on the farm, but the bulk samples would be representative of all of the lactating cattle throughout the healthy herd, again, without those sick or fresh samples. So 3 consecutive weeks and you're set to go. If you've had no previous detections, you would go ahead and earn that monitored unaffected status. The next option is in herds that have had previous detection. So there's 2 different routes you can take in that situation. If you want to stay consistent with just taking regular samples and not worrying about any of your sick cattle or the fresh cattle on the farm and collecting milk from those, you can do something similar to the first one that we talked about, except you add an extra week. So you would do 4 consecutive weeks of bulk samples. All of those samples would need to have not detected results, and again, no clinical signs suggestive of the infection, and you would be set to go. So 4 weeks if you have a previous detection, and you would earn unaffected status with not detected results. Now, if you are in a hurry and you want to acquire that status just a little bit sooner, there's also the option of doing 3 consecutive weeks. But in that situation, that last week, you would actually add in the samples from the sick cattle and any fresh cattle that might be on the farm. And then those additional samples in that 3rd week with not detected results would allow you to earn monitored unaffected status a week sooner. And the QR code on the screen takes you to a website where you can get more information about the herd status program. If you want to go ahead to the final slide here. So if you're interested in learning more about the program and getting enrolled, this QR code will actually take you to the website where you can look up your area veterinarian in charge and find out who that person is for your state. So that's the individual that you'll reach out to, and they themselves or their designee will help you to find out how you get started. And the state animal health official, along with the area veterinarian in charge, will collaborate with you to get you a herd monitoring plan. And that herd monitoring plan is just a basic template. It captures some general information about your farm, such as how many samples that you'll need to collect each week based on how many lactating cattle you have, who will be collecting those samples, etc. And all of that information will then be submitted to get you involved in the program. Once you're enrolled, you'll be able to go ahead and get that free access to the shipping kits and sampling labels, and then you'll be able to start collecting milk on the farm. And once you earn that monitored unaffected status, you'll be eligible for some of the benefits that we talked about earlier. And next, I believe we're going to go to Dr. McAlpin.
Thank you, Dr. Schwabenlander. Y'all have given us a lot of good information, so we got a couple of slides left here. And as Brad told us in the beginning of this discussion, the spread of H5N1 in dairy cattle between states and over large distances has been linked to cattle movements, while the spread between farms locally has multiple factors, which may include movement of people, animals, equipment. For this reason, biosecurity is a key step to mitigating the risk of disease spread on your operation. Next slide, please. Most importantly, biosecurity will only work if everyone on the operation follows the plan all the time. So your first step in protecting your herd is developing an enhanced biosecurity plan for your operation. An enhanced biosecurity plan can include how you limit visitors to your operation, the use of dedicated boots or boot coverings for anyone entering your premises, disinfection of vehicles, trailers, tires, and other equipment that might enter your premises. Your plan should also include methods and procedures to limit the interaction of livestock and pets with birds, and the frequency you need to check your livestock for signs of illness. Next slide. Once you develop your biosecurity plan, you need to educate yourself and those on your operation on the different components of the plan. And in implementing your plan, you should include only allowing people on the farm who need to be there. And when and where possible, having everyone enter and exit from one location. At this entrance point, you should maintain a list of any visitors entering your farm. And if needed, provide these visitors with disposable shoe coverings to wear while on your operation. Other potential mitigation activities may include wearing dedicated boots for use on your operation and around your livestock. And of course, do not borrow or use tools and equipment from other farms unless absolutely necessary. Next slide, please. For fairs and shows, if you're attending or participating in a fair or livestock show, please follow the event's plan. Make sure you clean and disinfect your shovels, forks, and other equipment often while you're there, and do not share or borrow someone else's equipment. You should also observe your cattle closely during, before, and after they return from the show. If you or your cattle appear sick, stay at home and seek appropriate medical attention from either your doctor or veterinarian. And you can also scan the QR code there at the bottom of the slide for more information. Next slide, please. For assistance in developing a plan or getting more information, contact your USDA area veterinarian in charge in your state. Next slide, please.
All right, a lot of valuable information. Thank you all so much for your time and sharing your knowledge with us today. Hey, before we wrap up, I'd like to take a moment to highlight some of the free resources we have available. On the Secure Our Herds website, you'll find a wide range of free tools and information, including many of the topics we covered today, such as available producer support, testing guidance, and the latest news and updates. Our website also includes helpful resources such as FAQs, biosecurity tip sheets, and other information. And this presentation from today, along with the transcript and the answers to all of the questions y'all put in the chat, will be available for downloading from the Secure Our Herds website soon. So be sure to follow APHIS on social media and sign up for news and alerts. We also want to send our sincere thanks, gratitude to today's presenters, Doctors Christensen, Sambita, Ringler, Schwabenlander, and Dr. McAlpin. We appreciate your valuable insight, your knowledge, and finally, to everyone who is in attendance joining us today, we greatly appreciate your interest in this topic and your time and just being here with us. Again, be sure to check that website for all of the additional information and other resources. So from everyone at USDA and at the Animal and Plant Health Inspection Service, we thank you, we appreciate you, and thanks for all you do to help us secure our herds.